Nifedipine ER is a medication used to treat high blood pressure, either on its own or in combination with other drugs. By lowering high blood pressure, it helps to prevent strokes, heart attacks, and kidney problems. Nifedipine ER belongs to a group of medications called calcium channel blockers, and it works by relaxing blood vessels to allow blood to flow more easily. The typical daily dosage for Nifedipine ER ranges from 30 to 90 mg, and it is usually taken once daily. It is best to take Nifedipine ER at the same time each day, either with or without food. When taking Nifedipine ER, it's important to follow your doctor's instructions. Usually, you will take this medication by mouth once daily on an empty stomach. Swallow the tablets whole and do not crush or chew them. Your doctor may increase your dose gradually based on your medical condition and response to treatment. It's important to use this medication regularly at the same time each day to get the most benefit from it, even if you feel well. Keep in mind that most people with high blood pressure do not feel sick. Do not suddenly stop taking this medication without consulting your doctor, as your condition may worsen. If you have any concerns or notice any changes in your routine blood pressure readings, be sure to inform your doctor. Also, avoid consuming grapefruit or grapefruit juice while using this medication unless your doctor or pharmacist says it's safe to do so, as grapefruit can increase the chance of side effects. Side effects of Nifedipine ER may include headache, dizziness, nausea, flushing, constipation, leg/muscle cramps, or sexual problems. To reduce dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. If any of these effects last or get worse, tell your doctor or pharmacist promptly. This medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including swelling of the ankles/feet, shortness of breath, unusual weakness/tiredness, fast/slow/irregular heartbeat, fainting, mental/mood changes, swollen/tender gums, vision changes. Although this medication is effective in preventing chest pain, angina, some people who already have severe heart disease may rarely develop worsening chest pain or a heart attack after starting this medication or increasing the dose. Get medical help right away if you experience worsening chest pain, symptoms of a heart attack, such as chest/jaw/left arm pain, shortness of breath, unusual sweating. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before taking Nifedipine ER, it's important to let your doctor know if you have any allergies, especially to other calcium channel blockers. This medication may also contain inactive ingredients that could cause allergic reactions, so it's a good idea to talk to your pharmacist about any concerns. It's important to discuss your medical history with your doctor or pharmacist, especially if you have heart, liver, or kidney problems, or a certain metabolic disorder. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications you are currently taking, including prescription drugs, non-prescription drugs, and herbal products. Nifedipine ER may cause dizziness, and this effect can be increased by alcohol or marijuana. It's important to avoid driving, using machinery, or engaging in any activities that require alertness until you know how this medication affects you. Limiting alcoholic beverages is also recommended, and it's important to consult with your doctor if you use marijuana. If you are pregnant, it's important to discuss the potential risks and benefits of taking Nifedipine ER with your doctor before using this medication. If you are breastfeeding, consult with your doctor before using this medication as it can pass into breast milk. It's important to be aware of potential drug interactions with Nifedipine ER, as they could affect how the medication works or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's also important to note that other medications can affect the removal of nifedipine from your body, which may impact how nifedipine works. Examples of such medications include apalutamide, enzalutamide, midotane, quinapristine/dalfopristin, St. John's wort, rifamycins, such as rifabutin, rifampin, and drugs used to treat seizures, such as carbamazepine, phenobarbital, phenytoin, among others. Additionally, some products may contain ingredients that could raise your heart rate or blood pressure. It's important to inform your pharmacist about all the products you are using and to ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. Always consult with your healthcare provider to ensure the safe and effective use of Nifedipine ER. If you or someone else has taken too much Nifedipine ER and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. Symptoms of an overdose may include severe dizziness, fainting, and a fast, slow, or irregular heartbeat. It's crucial to act quickly in cases of overdose to ensure the affected person receives the necessary medical attention. It is important not to share this medication with others and to keep it out of reach of children. Making lifestyle changes such as participating in stress reduction programs, engaging in regular exercise, and making dietary changes may help to increase the effectiveness of Nifedipine ER. It's important to talk to your doctor or pharmacist about lifestyle changes that might benefit you. While taking this medication, your doctor may want to monitor your liver and kidney function, as well as perform an EKG. It's important to attend all medical and lab appointments and consult your doctor for more details. Regularly monitoring your blood pressure while taking Nifedipine ER is essential. Your doctor can show you how to monitor your blood pressure at home, and it's important to share the results with them. It's important to note that there are different tablet strengths of this medication available, and some tablet strengths may not be used in place of others. Do not change tablet strengths or adjust the number of tablets you take without consulting your doctor or pharmacist. If you forget to take a dose of Nifedipine ER, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next one at the regular time. Don't take a double dose to make up for the missed one. It's important to take the medication at the same time each day to maintain a consistent level in your body. When taking Nifedipine ER, it's important to store it at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When it comes to disposing of Nifedipine ER, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.